Hi, I'm Dr. Kwan from S Aesthetics Clinic.
Hi, this is Jill from S Aesthetics Clinic. Today, I'll be speaking to Dr. Kwan Yen Tong from S Aesthetics on how to remove dark eye circles. What are dark eye circles?
Dark circles refer to the darkening of skin under the lower eyelids.
How do dark eye circles form?
Dark eye circles form due to two main factors: blood vessel congestion and engorgement, giving rise to a dark bluish, greenish, or purplish hue under the eyes, and hyperpigmentation.
What can worsen dark eye circles?
Lack of sleep and poor sleeping habits, allergies, overexposure to sunlight leading to increased pigment formation, aging, smoking, and inherited genes.
So, what are the treatment options?
Lasers, which target the blood vessels and pigmentation under the eye. Under eye fillers, which are used to mask the blood vessels under the eye, as well as stimulate collagen to improve elasticity and skin thickness. Rejuran-I, which repairs damaged skin cells and stimulate collagen. Skin tightening devices such as Ultherapy and Thermage, which can reduce skin laxity and reduce fine lines in the under eye area. Skincare products, such as products containing ingredients that lighten the pigments and protect the skin from UV-induced free radical damage.
Are the treatments painful?
Most treatments for dark eye circles are very tolerable. Some treatments may require numbing cream or local anesthetic.
How soon can we start seeing results?
Results vary between people. Fillers usually yield immediate results, while lasers and skin tightening devices show in time and may require several sessions before optimal results are attained.
Any downtime?
Most treatments have minimal downtime. Minimally invasive treatments such as fillers and Rejuran-I carry a risk of bruising and swelling, which may last a few days. At S Aesthetics, we understand that every patient is unique. Our treatments are customized so that the treatment plan is personalized to each patient's unique problem. Thank you for watching.